Hello, this is Emil Mikhail. Today I am talking about rheumatoid arthritis. What is rheumatoid arthritis? It is an autoimmune disorder causing chronic systemic inflammatory disease. Rheumatoid arthritis has a higher incidence in women than men and increased in older individuals. How the body normally functions. There is plenty of cartilage and room for the joint to move. What happens in rheumatoid arthritis? Autoimmune disorder causing chronic systemic inflammatory disease. Rheumatoid arthritis occurs in steps. The first step in the development of rheumatoid arthritis is an abnormal immune response causing inflammation of the synovial membrane with vasodilation, increased permeability, and the formation of exudate causing red, swollen, and painful joint. After the first period of acute inflammation, the joint may appear to recover completely. Pannus formation, granulation tissue from the synovium spread over the articular cartilage, release enzymes and inflammatory mediators, destroying cartilage. Cartilage erosion. Cartilage is eroded by enzymes from the pannus, creates unstable joint. Fibrosis. The pannus calcified, and the pannus between the bone ends become fibrotic, limiting movement. The calcifies and the joint space is obliterated. Ankylosis. Joint fixation and deformity develop. This process repeats, causing further damage. Severity reflected by number of joints involved, degree of inflammation, rapidity of progression. As we see here on the left side normal joint, we see synovial joint, we see here cartilage. And the right side rheumatoid arthritis, as we see here swollen inflamed synovial membrane. Also we see here erosion, cartilage erosion. Symptoms and signs. Rheumatoid arthritis is insidious at onset, often becoming manifest as a mild general aching and stiffness. It causes pain, swelling, stiffness, and the loss of function in the affected joint. It can be affect any joint, but is common in the wrist and fingers. Joint movement is impaired by the swelling and the pain. Frequently and daily activities become difficult. With each exacerbation of disease, the function of the affected joint is further impaired as joint damage progresses. Eventually, the joint is no longer inflamed but is fixed and deformed. Effects on other body system, comorbid process. Since the joint is not as functional as before, muscle atrophy because of disuse that destabilizes on already destabilized joint. Muscle spasm may cause bones to become more misaligned. Deformities may develop because of this destabilization and misalignment. As the muscle and other surrounding tissue become affected, walking and movement can become very painful. May also result in anemia that is resistant to iron therapy. Inflammation may affect the heart, lungs, and kidney. Diagnosis by synovial fluid analysis that demonstrates the inflammatory process. Rheumatoid factor may be present in serum. Erythrocyte sedimentation rate may be elevated. C-reactive protein may be elevated. Radiography of hands or feet, ultrasound scan may show early sign of synovitis that cannot be identified with radiographs. Treatment. Balance between rest and moderate activity to maintain mobility and muscle strength while preventing additional damage to the joints. Physical therapy and occupational therapy to reduce pain and maintain function. Proper posture help to maintain function. For pain control, high dose of anti-inflammation may be required. In more severe cases, glucocorticoids may be prescribed and administered orally or as intra-articular injections. The use of heat and cold can be very effective when they used correctly. Surgical intervention to remove penis, replace damaged tendon, reduce contractures, or replace joint may be necessary to improve function. The nurse role. Help and support the patient and the families. Rheumatology nurse specialist may be heavily involved in monitoring and advising people about how to manage their disease to enable optimal function. Patient education about rheumatoid arthritis. Provide the care to the patient based on the treatment plan prescribed. Questions. First question. Rheumatoid arthritis is viral infection, result of injury, bacterial infection, autoimmune disorder. The answer is D, autoimmune disorder. Question number 2. What is PANAS? The type of virus that causes rheumatoid arthritis. Granulation tissue that releases enzymes and inflammatory mediator that damage cartilage. The main joint that is affected by rheumatoid arthritis. The main symptoms of rheumatoid arthritis. The answer is B. Granulation tissue that releases enzymes and inflammatory mediator that damage cartilage. Question number 3. True or false? Rheumatoid factor in serum is a requirement of diagnosis with rheumatoid arthritis. The answer is false. Question number 4. True or false? The inflammation of rheumatoid arthritis is limited only to joints. The answer is false, because may also affect lungs, heart, and kidney. Question number 5. Name 2 things the nurse may do to assist the patient with rheumatoid arthritis. Provide information, provide assistance with treatment protocol. Now we reach the end. References